I'm Dr. Pete Economou, the East Coast psychologist.
And I'm Dr. Nikki Rubin, the West Coast psychologist.
And this is When East
Meets West.
Put me in, coach. I'm ready to play.
Oh, you had that one teed up.
Yeah.
It's another pun. See, another sports pun. I just
Yeah. Teed up. Yes.
I didn't have that teed up, by the way. That was Nikki's cleverness on the fly.
Nikki's always clever like that. That
No,
I
no,
know.
I don't know if that's true. I don't think that's true. But
So there's so many people, and this semester I taught a course in executive coaching, and there's a lot of people that, my students included, but just in the general
yes.
population that are saying like, hey, how is coaching different from therapy? And so I thought you and I will break that down. What do you think?
Yeah, I think that's a great call. I think it's a great call because look, there can be some overlap. Like definitely I would say as therapists, we end up doing a lot of sometimes like similar things to coaches in terms of
Yes.
problem solving. However, there's also a lot of differences, and we want people to be informed. That's why we that's why we have this podcast, right? We want people to have all the psycho ed they need to make a decision about what's going to be most supportive for them.
Absolutely. Yeah. And
So
yeah.
yes.
And so
Oh,
that's
I'm
what,
sorry. I was like, I'm excited to hear. I'm like, tell me what I want to hear about your executive coaching course that
yeah.
you taught.
Well, and I like that you said that because you said like, as therapists at times we could also be doing coaching or, is coaching doing, therapy, like which came first type stuff. And the truth is,
Hmm.
psychology came first and coaching is, borrows some of the theory, and some of
Hmm.
the,
Sure.
rapport and ethics and some of that type of stuff.
Hmm. Hmm.
So
Sure.
we'll talk about that. We'll break that down to different type of coaches. What came to mind when you were saying that was also, you and I are both cognitive and behavioral therapists. And so I think
Hmm.
we're more likely to say we're coaching because that's the nature of CBT and evidence-based practice. Whereas, if a listener wants to tune into like the psychoanalysis episode, like someone practicing psychoanalysis is unlikely to call themselves a coach or less likely.
That's actually, yeah, that's an excellent point. That's actually very important. Yeah, I mean, there's a broad spectrum of different types of therapeutic approaches, so that's correct. Though I would say, I mean, because there's not as many sort of, I'll say like old school analysts as there what once was. So even people I think that are psychodynamic, I think a lot of them would say they engage in practical coaching and a lot of times, right? Like just, I guess a lot of us wouldn't use the term, like I wouldn't use the term coaching. I think I'd probably say I'm problem solving. I'm like being active and helping people problem solve sort of practical
Yeah.
issues.
Well,
Um,
and well, and this is also West Coast, East Coast different because I think people practicing psychoanalysis on the West Coast might be a little different than our East Coast psychoanalysis folks. But because I don't think many people here would
mhm.
say that. But either way, the other thing,
Oh, I'm saying psychodynamic versus psychoanalysis. So
oh, that
like
too,
folks that
right?
are like more modern psychodynamic. Yeah.
Yeah,
Hmm.
they might. Yeah, yeah.
Yeah.
So there's also the idea that because one of the things that coaching sort of differentiates from therapy is they'll say that coaching is the how or the what and that
Mm,
therapy is the
mm.
why. And I have a really hard time with that
Oh.
because, especially from the Eastern perspective, I like delete the word why. Like I'm like if a
Mm.
client's saying why, I'm like, well, you're judging. That's the very basic side of when we look at why. Um, and so, y- yeah,
Yeah, I'm very interested in that because I'm going to gently disagree with you because I think
shocker.
we ask why yeah, sure. Because I think we ask why a lot. We want to understand like the function of behavior. That's a why. Like why is
Well,
somebody
but
doing what they're doing, right? Due to learning history or to biology or to, you know, behavior's been reinforced over time, et cetera, et cetera.
yeah, so contextually, certainly you can like dissect behavior still,
Yeah, yeah.
but for example, if someone's saying like, I don't like, why do I feel sad all the time? Or, something of that nature. And like, look, you can target certain things, but there's just some people who are predisposed to some of these types of emotions. And ultimately, so again, from this like real Eastern perspective, if I'm constantly asking why, then I'm not actually accepting what is. So it's a fine line to how you get to the core versus
Sure.
you know, really embracing where you're at.
Sure. Sure, that makes sense. I hear that. I guess then I was, yeah, the contextual piece here I think is
Yeah,
essential because it's like there's no time to, I mean, we are humans. It's okay to ask why sometimes, right?
sure.
And sometimes having an answer can be very helpful, and other times asking why takes on an avoidant function and it's not
Yeah.
getting us
Well,
to,
that's the
as
thing.
you're
And
saying,
like
deal with what's happening in
hypochondriasis or
real
something
time.
where they're like constantly going to
Sure,
doctors and then, they're like, why am I always
sure,
sick? It's
sure,
like, well, you haven't accepted that, your health or things of that nature. So,
sure, sure.
so I think that's where, so in the semester teaching executive coaching, there was
Hmm.
that we almost every week we had to use the Venn diagram of, coaching versus therapy. And so,
Mm,
maybe we'll put that up for listeners, but this, because there is overlap. So to be clear,
yeah.
even, and there are organizations that credential coaches, and there's different kind of
Hmm.
coaches. So talk to me about some of the coaches that you're aware of, the different types of coaches that are out there.
Yeah, well, and I also I do want to make sure we circle back because I want to hear what's on that Venn diagram because
I will.
I think that I find that helpful. And if I would, I imagine people listening probably would also. But I think probably the two that come to mind most for me in terms of like the overlap with therapy would be executive coaches and life coaches. Those are the
Yeah.
two we kind of hear a lot about. But then of course there's like just all kinds of coaches. Like there's like sports coaches, right?
Yeah.
There's like there are dating coaches,
Yeah.
there are business coaches, and I
Yep.
don't mean executive coaching. I mean people like I do some business coaching for people in private practice, for
That's right.
example,
Yep.
for mental health clinicians.
Well, that's one of our
You know,
sponsors.
Right, it was exactly right. The complete private practice toolkit. I can't even
Yep.
say the title of my own course there. Um, so, so yeah, so there's a lot of different types of coaches, but the ones that I think about that might like fall into that Venn diagram would be executive coaching and life coaching,
Yeah.
frankly.
And so I'll give you the Venn diagram. I mean, it really is just the way we did it more simply was just the overlap between just coaching more globally and therapy. Because,
Okay, okay,
because I teach in a graduate school of psychology, there's a lot of people who have the interest in doing some type of therapy.
right.
But the more organizationally focused kind of student is also open to like the coaching type stuff where
Hmm.
exactly. And there's also, I don't know if you said it, but like wellness coaches is another thing.
Oh, right. I didn't say it, but that's exactly right. Nutritional coaching. I mean, we can go
Yes.
on and on now that I'm thinking
Yeah.
about it. Yes.
Yeah.
So what's on the so what were the what were the differences and what was the overlap on
Yeah.
the on
Oh,
your Venn diagram?
sorry. Yeah. This is you're actually asking a really good question.
Yeah,
Um,
yeah.
well, again, I think the coaching part was more like it was developmental, it was kind of targeted problem solving. Um,
Mm,
I, I think because I'm so middle path, I always had a hard time with
hmm.
it where I felt like depending on the moon, if you will, like um I don't know, think of gravity or something like this. Like it
Sure,
could
sure,
probably be
sure.
pulled in all these different directions. Whereas therapy
Uh-huh.
was like, the why, psychology based, things like that. And in the middle was just that, everything else because there was just a lot. So there was I think ultimately what we found and throughout the course of the semester, we found that in order to be the best type of practitioner either way is about clear boundaries, ethics, and like informed consent. So really starting and
Mm-hmm,
operationalizing what the relationship is. So even if a listener is exploring therapy versus
mm-hmm,
coaching, I think it's important just to ask
mm-hmm,
whatever the provider is, like what are they giving you, and define it.
mm-hmm. Yeah, and I think maybe what comes to mind for me is like the most obvious difference is um, if you're a mental health practitioner, you are treating illness
Yes.
sometimes, and I know
Yeah.
that some people might disagree with or not like that word, but I just mean it as like mental, just like, and again, whether a mental health therapist has a doctoral degree or not, it's like being the health practitioner, being the
Yes.
doctor or the nurse, right? And so
Well,
a
it's
coach
there's a
doesn't treat.
there's a diagnosis and a a billing. So that's one of the other differentiations.
Well, that too, that as well from a practical standpoint,
Yeah.
absolutely. And I think I more mean that like it's a dimension of functioning, whereas like mental health clinicians, we can have some overlap and like we can deal in like all the other parts of being a human, like
Yeah.
existential issues, spirituality
Yes.
issues, conflict, career issues, and like anxiety disorders, depression, things like that.
Yes.
So a coach isn't going to be dealing in that arena. We could even say we could have another diagram. It would be like, what's the overlap with like any kind of um religious or spiritual counseling, frankly.
Sure. Yes.
Right? Where
Yeah.
they might be doing something similar to what we do or coaches do, but
Yeah.
I don't know. So there's just like many ways to
Yeah.
support and support human difficulty, maybe is a
Yeah. Absolutely.
general way of saying it. Yeah. Uh-huh.
Yeah. Yeah. And I like that you brought that up. There's a pastoral counseling. Now, some of them are licensed and some of them are
Hmm.
not licensed. And so, you
Sure.
know, I think for listeners, it's just, and I don't know, what do you think about that? Like, well, because we have this thing now, oh God, a good faith estimate.
Oh yeah, but that's been around for a little bit actually.
Well, I know.
Do you know
We'll
that?
see there.
It's a little like it's been
Yeah.
around for a little. Might not stick around, but yeah. Uh-huh.
But to me that's sort of like an informed consent, like it's an added level of like what am I getting and how much could it cost? Because also the other thing is, coaching is regulated ish, um,
Hmm.
regulated light because they're not licensed. And so I think as therapists, we are licensed. So if I'm a social worker, a counselor, or a
Hmm.
psychologist, I have
Yes.
a
Uh-huh.
license, which means I am
Yes.
bound by that state's regulations for the practice.
Yes. Sure. Sure.
Now,
Yeah,
coaching,
exactly.
yeah,
Coaches don't
coaching
have
is a
that.
certificate. There is the ICF, which is the International Coaching Federation.
Yes.
There's
Uh-huh.
ethics and there's sort of responsibilities there,
Hmm.
but there's like no real penalty per se. Like if you lose, let's just say someone acted inappropriately, and let's just say they lost their certificate, that doesn't actually prevent them from still practicing.
Yeah, that's a great point. And I think this is where, because I was kind of basically asking you next, like, how do you think people should go about determining, like, what do I need, a coach or a
Yeah.
therapist? And
You
so,
answer
like,
that.
I'm thinking, well, you're like, I don't know. I
That's a
don't know
good
how to answer that.
question.
Yeah. I mean, I'm thinking of like one that's like popularly read a lot. It's like around dating coaches, like
Yeah,
seeing like,
yeah,
that's like in the news a lot. And so I don't like, look, dating coaches could be helpful. I've had patients that work with dating coaches or, and
yeah.
learning different ways to be more skillful. It's just
Mhm.
learning the behavior, just like if somebody wants to like get a golf coach, I don't know, like there's like
Yeah.
just learning to do a behavior more skillfully that I'm in support of that. That makes
Mhm.
sense. Though, let's say they got really, really bad advice or guidance from a dating coach and they were being told to do things that they felt, I don't know, harmed them in some way. It's like there's no recourse on that, right? It's somebody, if
Yeah.
somebody hangs up a shingle, on the
Yeah.
internet, a metaphorical shingle here that says, I'm an expert in dating. I
Yeah.
mean, okay,
Yeah.
there's no there. Whereas, for licensed professionals, we're held to the standards of our regulatory boards.
Yeah, I don't think we could even really say we're an expert like that. Like I know that I've had colleagues that have been sort of challenged about having stuff like that on their website, and it gets a little tricky because again, like what's the metric there? But I think, it's important that we just, the state regulations are to protect the public. And so,
Hmm.
I served the licensing board for 10 years, here in New
Yes.
Jersey. And so that's sort of why I teach this class and some of this content because I'm pretty, intimately familiar with some of the statutes and regulations and sort of how it all works. And so it's to protect the public. And, these, coaching certificate organizations are also trying to do the same thing. They just don't have
Yes.
jurisdiction, so they don't.
Right.
Whereas, like, as a licensed provider, if I am found to have been doing something unethical or illegal, I'll be banned from practicing really in any state, because it will follow you.
Right.
Now, I'll tell
Sure.
you, it doesn't follow as easily as you would think. Uh, people have certainly lost
Yep.
licenses. There's a bunch of good podcasts about this, where,
Hmm. Hmm.
physicians or surgeons will practice in one
Hmm.
hospital and have a really high mortality
Hmm.
rate and then show up in another hospital somewhere else and kind of conduct the same sort of thing.
Dr. Phil
Yeah. Well, Dr.
is a
Phil
famous
lost his
one.
license.
Dr.
Yep.
Phil, who's lost his license in Texas for
Yeah.
an ethical violation, and
Yeah.
but went on to become very famous in espousing um, psychological advice and guidance, but
That's right.
not as a licensed psychologist, right?
Yeah.
So yeah, we're getting, I guess we're getting a little off topic here, but I'm going to bring us back and say, so how then, if somebody came to you, Pete, and they were like, well, should I get a coach or should I get a therapist? Because I think something that I think a lot about is, my bias, of course, is going to be like a therapist can do all of the things, right?
Right.
Which is true, right? For if a well-rounded clinician,
Yeah.
we would expect to be able to do a lot of most
Yeah.
of these things. Though, you know, I'm not a golf coach, you know what I'm
Right.
saying? For example, like I can't help, so like I do think there's a place for coaching. And so I'm
Yes.
wondering like how would you advise somebody in sort of like sifting through what's right for them or what they need?
Well, I was throwing the question back on you, but I'll take it. I'll say there's a few things here. One, when somebody's trying to differentiate that, if they've never done therapy, it could be important to explore that, but if they've done
Hmm.
therapy and they, felt like they've gotten what they want out of it, then that's sort of an easier
Hmm.
like pathway
Hmm.
potentially,
Hmm.
depending on what the
Sure.
presenting problem is. I think, like you said, like never am I doing sport coaching, or even with the athletes I work with, I'm like, look, I'm not here to tell you how to jump or how to, and actually, I don't care if you win or lose. I just want to find like what your values are and how do you stay motivated and
Hmm.
and things, kind of
Hmm.
more. And then in
Hmm.
business wise, like I'm not telling you like what stocks to trade. I'm just helping you, right? Like
Right.
figure out how to
Right.
manage your team, how to develop a strategic plan. These are things that can kind of that are like common denominator stuff that then the person has to, insert the
Hmm.
specifics to their
Hmm.
field. So, it
Hmm.
really and if someone is going to retain me and start to work with me, they just again, my informed consent is, look, this is not therapy, but it might feel like it from time to time because I'm going to hear things that maybe other people wouldn't hear, or I'm going to.
Hmm.
And so that's kind of like, and then if it starts to cross over, then I might refer, because again, for us
Mm.
as licensed
Yes.
folk, it could get a little challenging. But
Sure, sure.
lastly, and I know you were going to reference like one of the books that you really, use a lot, but I
Yeah.
also think it's
Uh-huh.
important, like it takes a village. And so I have a ton of people
Yes.
around me in networks where I refer
Same.
to.
Yeah. Yep. Yep. Well, and I think like what you're get like the thing that I'm hearing most clearly in what you're sharing about your process is like it's basically, when there's something actually quite targeted that
Yes.
somebody needs and specific, right? And so like kind of like going back to what I was saying about like my bias of like I can be like, well, a good clinician can do a lot of the things that a coach can do with the added benefit of,
Yeah.
the mental health piece. So a good clinician also recognizes we don't know, you don't know everything. We don't know
Yes.
everything. We don't have expertise in everything. And so when you see that somebody needs really targeted support, referring to a coach can be, I think, really powerful
Yes.
and helpful. And I was also thinking, though, and this one is probably worth saying, is like finances can also be a reason. Like if somebody needs something
Yeah.
targeted, maybe they need like 4 coaching sessions around one particular issue. Maybe
Yeah.
they can't afford therapy, or maybe therapy's more affordable because their insurance reimburses it
Well,
and
that's it.
coaching's
Yes.
not, right?
Yeah.
Like
Very good. Yeah.
that thing
Yeah.
too. So I think, I think that's another thing about like what somebody needs. It's like that's a factor as well, like what kind of help is most available at this given moment in someone's life.
Yeah. And so if someone's out there, if you're
Yeah.
considering what's best for you, just know that just take that first step. You never know which way you're going.
Well, and I want to mention the book that I was going to
Yeah.
talk
Yeah.
about,
Yeah.
which is
Yeah.
like from a coach. So there's a very famous she's a coach, Martha Beck. She has a PhD in sociology, and she wrote an awesome book during the pandemic called The Way of Integrity,
Yeah.
that I recommend to a lot of patients. It's got a very like Eastern flavor, even the Way of Integrity. It's kind of like a Taoist translation a little bit.
Mhm.
And she's a coach, and and there's some overlap. She cites Steve Hayes from ACT. She uses some very ACT kind of interventions, but I think like that's an example of like I love that that's written by a coach. I literally recommend it to people all the time.
Yeah. So take that first step and know that it requires a village. So it's not just one.
This has been When East Meets West. I'm Dr. Pete Economou.
And I'm Dr. Nikki Rubin. Be present, be brave.
This has been When East Meets West. All material is based on opinion and educational training of Drs. Pete Economou and Nikki Rubin.
Content is for informational and educational purposes only.